Hello, my name is Lori Haling, and I'm doing a teaching demonstration today for certified nursing assistants for a sepsis preventing infection, the hand washing video. I would start out my demonstration with making sure each one of my students is provided with a copy of the Your 5 Moments for Hand Hygiene. It goes over different touch points of when it is proper to inappropriate to wash your hands or use an alcohol-based hand sanitizer. The first step would be prior to entering the room or touching a patient. You want to make sure that you are cleaning your hands with a good alcohol-based sanitizer or hand washing before bringing anything into the patient's room. Think of if you've left someplace, touched something in the hallway that could be contaminated, you are now trying to prevent from bringing that into your patient. The second touch point would be cleaning your hands before performing a clean or aseptic procedure. This is such as oral care, patient feeding. You want to protect patient against harmful germs on your hands and patient's own germs that may be then contacted on your hands. The third step is after any body fluid exposure risk. These are things such as any contact with urine, saliva, sputum, feces, or blood. You want to make sure that you're cleaning your hands immediately after exposure to these body fluids and before and after glove removal. This protects yourself from contamination and also the healthcare environment from harmful germs. The fourth touch point is after touching a patient. You want to clean your hands immediately after touching a patient. This is when you're doing any activities of daily living. If you're helping a patient in walking to the bathroom, walking down the hall, if you are positioning them in bed or in a chair, those are things that you want to immediately wash your hands afterwards to make sure that you are not passing any of those germs around. And then you also want to take into consideration number 5 is when you're touching any patient belongings. Let's say you're cleaning off their bedside table, or if you need to move their wheelchair, their walker, move their tray from their food to a cart, anything that would be in their constant touch area or immediate area, you want to make sure you're washing your hands or using a good alcohol-based sanitizer, as we do not want to be taking patient germs anywhere else. Or even if you're not touching those surroundings, before or right after leaving that patient's room, you want to make sure that you are leaving cleaning your hands either with the alcohol-based sanitizer or hand washing before you move on into another patient's room. Again, just trying to keep from spreading anything to anybody else. Using a good hand sanitizer, you want to make sure that you are using a 70% alcohol-based rub. And I will show you, we want to make sure that we're putting enough in your hand that you can cover all surfaces. So you want to make sure that it is wrists, entire hands, fingers. You're going to rub vigorously until this dries. Once it's dry, you know that you've got that all your surfaces are covered. This is the quickest way to decontaminate your hands. You do want to make sure that it's dry before you do anything else. That is just that alcohol base is evaporating. So that would be it. Once it's dry, you can go ahead and do the tasks you need to do. Again, those 5 touch points, always trying to, again, quickly cover all the surfaces, rub it in vigorously until it's completely dry. The next part of the demonstration will be the actual hand washing. Best way to set up your area for hand washing is to make sure that you have access to your, bear with me, I'm trying to videotape in a bathroom here. I have my sink, my hand soap, there is the paper towels, and my waste basket so that I'm able to I'm able to go ahead and do the hand washing and dispose of everything properly. So I am going to just demonstrate this. I think I will need to move my wastebasket so that is readily accessible. Okay, so you want to start with making sure that you have a nice warm water. You don't want to have it too hot because you do not want to have that water really kind of making your skin more dry and crappy. So most healthcare providers do wear a watch. We want to make sure you slide the watch up to expose the wrist as much as possible, get the hands wet. You want to use enough soap so that when you're putting the soap on your hands, it is enough to cover the entire area, including your wrists. And we want to make sure that you're rubbing vigorously. You do need to do it for 20 seconds, and you want to make sure that you're getting all the areas. You want to get between your fingers, so a good scrub here, the back side of your fingers, and then you do want to get your fingernails. We like to keep our fingernails short so we're not carrying germs around, so it's a good scrub on the fingernails. You want to make sure that you're getting your thumbs. And then again, you want to get your wrists good. Now, to make sure that you're getting that 20 seconds, you can do the ABC song or the Happy Birthday song twice, and that should come out at a nice normal speed to that 20 seconds. When you go ahead and rinse, you want to make sure that you're keeping your hands downward, letting the water wash over your wrists and down through the fingertips, so everything is just flowing off your hands. Then you're going to take your paper towel and you're going to dry those hands thoroughly. You want to make sure that, again, just kind of making sure everything is dry. You dispose of your paper towel, and then you take a clean paper towel to shut off your faucet. Then dispose of that paper towel, making sure that you're not contacting or touching things that after you've actually washed them. Thank you.